of the policy advocacy for genetics and genomics course. Our topic is, should genetic testing be used as a mandatory part of the premarital screening to prevent hereditary diseases in African countries? We're in the affirmative group. My name is Ogoburuge Benedicta.
And my name is Ahmed Sharifdin Adimeji. Thank you.
We're from Nigeria.
Yeah.
Genetic disorders pose significant public health challenges, particularly in Africa, where hereditary conditions disproportionately affect the population. For example, sickle cell disease alone affects 1 in 4 Nigerians, according to Makani et al. 2018, causing immense suffering and economic strain. We agree that implementing mandatory genetic testing in premarital screening is a preventative, ethical, and policy-based approach to mitigating these challenges.
Now imagine a world where families no longer have to suffer the devastating effects that genetic diseases cause, and these diseases have to go into being an hereditary disease, moving from one generation to another. Now, this kind of world, this kind of future is only possible if we make genetic testing mandatory for premarital screening in African countries to prevent this challenge. And it's not going to prevent these hereditary diseases alone. It's going to help us to reduce healthcare costs and also promote informed decision making for intending couples. So in our own case, we want to prioritize public health and informed decision making over mere romantic feelings that goes into marriage, that transition into marriage based on scientific evidence that we have, and also global policy precedents that countries that have actually implemented this policy in the past, and some ethical considerations that actually back up our claim. And in this, to support our stance, we have four constructive arguments. And the first one is that implementing mandatory genetic screening for premarital marriage is going to help us to prevent genetic disorders, just like we said before. And the World Health Organization actually claimed that genetic disease is one of the rampant genetic conditions that we have in Africa. For example, over 300,000 babies are born annually with sickle cell anemia in Africa. And this high number of babies that die in a year with this pandemic disease actually results to 50 to 90% mortality rate before the clock 5. This is a very disturbing number. And we have a case study of a country that's actually implemented mandatory genetic screening. An example of this is Saudi Arabia. Since 2004, they've implemented the policy of conducting mandatory genetic screening for intending couples, and this helped them to reduce sickle cell and thalassemia cases by over 90%. This is very outrageous, and this is something that Africa can also emulate. And what this is going to help us to do is to provide an early intervention, reduce hospitalization, and lower economic burdens on families and the healthcare system. Because the reality is that these economic burdens goes beyond family level. It also affects national healthcare system, because the nation has to provide for a healthcare system that can actually support the hospitalization of the victims.
Next, we have economic and the healthcare burden reduction. Genetic disorders cost billions in healthcare expenditures due to frequent hospital visits, treatment, and long-term care. The annual cost of managing sickle cell disease in Africa is over $1 billion. Yet, prevention through screening is far more cost-effective. Preventing the birth of children with severe genetic diseases reduces the financial burden on families and national healthcare system.
Moving on, we also believe that making genetic screening mandatory for intending couples is also going to help us to empower couples with knowledge and informed choices in the area of reproduction. And what we are doing is not about banning marriages or preventing couples that can actually get into marriage. But what we are doing is that we want to provide them with scientific information that allow them to make informed reproductive choices on the kind of babies that they're actually reproducing, and also to give them possible couple option like IVF, in vitro fertilization, or through embryo screening to see if their embryo is going to develop into babies with genetic diseases. An example of this is Cyprus, which have actually implemented this genetic screening for thalassemia, and which leads to this an almost complete eradication of disease in newborns.
We have the ethical and social responsibility. Article 25 of the Universal Declaration of Human Rights, UDHR 1948, guarantees everyone rights to adequate medical care. Preventing genetic diseases through early screening aligns with the fundamental human rights. Couples deserve the right to be fully aware of their genetic risks before starting a family.
At this point, we believe that our opponents can actually come up with some points to back up their claim to actually oppose this motion, and that is why we have prepared these rebuttals. Number one, they might come up and say that genetic testing is violating autonomy, personal freedom, and choice. But we tell you, panel, that this is not the case, because in our own case, we are prioritizing community well-being over individual choice. And even if individual choice is left out, we understand that every government policy actually prioritize public health over individual choice, especially when it is a matter that actually like affect the whole community. Because in reality, if we have pandemic like genetic diseases in the community, it's not going to affect one individual or one family. It goes beyond family level. It can become a community pandemic. And government already enforce mandatory vaccinations and infectious diseases that can actually protect public health. And this is the same for genetic screening as well. It follows the same mandatory vaccinations and infectious disease. We've seen African countries that are actually implementing mandatory vaccination for kids, for teenagers. So we can do the same thing for genetic screening before intending couples can get into marriage.
Stigmatization. Stigma arises from ignorance and not deception. Counseling and public education to ensure results are used constructively. And existing policies provide strong protections against genetic discrimination.
Alright, the third point that we believe that opponents can actually raise is the issue of breach of confidentiality. Panel understand that confidentiality is a standard ethical practice in medicine. We understand this. And we also believe that genetic testing can be conducted in a way that is going to follow the strict data protection framework that we have in African countries. And even without that, legal safeguards and secure medical data system can help us to ensure we can provide this to ensure that results remain confidential between all the parties that are involved. I mean, the individual, their partner, and the health professionals. So this confidential information does not have to go outside these three parties, and the risk of confidentiality breaches does not even outweigh the benefit that we stand to gain from preventing severe hereditary disease. Because if you look at it at the larger scale, we realize that the risk of confidentiality breaches does not even outweigh the benefit that we stand to gain by making this mandatory.
While genetic testing can be costly, the long-term cost of treating genetic diseases far exceeds the cost of screening. Governments can subsidize testing just as they do with vaccines and other healthcare programs. And some NGOs, and I think there are also some programs that are being made in place for them on the basis of this genetic testing already.
All right. We also may come across a point about limitation of premarital genetic screening, about the fact that premarital genetic screening is only effective with some diseases, but we realize that even if screening like only focuses on the most common genetic diseases, this does not make it ineffective. We can actually identify some other high risk carriers for prevalent condition. For example, thalassemia, sickle cell disease, that has a significant impact in reducing this genetic disease burden. We can also implement this for other diseases, and in the long run, when we start to expand in African countries, when we start to expand our funding and technology improvement, we can see this significant impact in other high risk diseases that we also have in African countries.
They might also come up with a parental load from informed reproductive choices, such as seeking medical interventions. Example is in vitro fertilization, which comes with genetic selection or donor options. The focus is not to break relationships, but to inform and help solutions.
Alright, lastly, we also believe that our opponents can come up and raise an issue about the fact that we have numerous cultural and religious differences in African, and this is a fact, and this is the reality of African countries. But we believe that cultural and religious practice is something that actually evolve over time. We have a lot of ideologies that actually spring from different religions that we have in African countries, especially Nigerian. And this is something that is very crucial, especially when it concerns public health. And we have a lot of religion today that actually like supports medical screening. For example, we have Islam. Islam actually like is a religion in African, is a popular religion in Africa, and actually supports the fact that intending couples have to undergo blood group testing and even HIV testing before they go into marriage. And for example, Iran is a country that actually implemented this policy, and they've been able to like reduce they've been able to eradicate thalassemia before like in babies that are born out of marriage. So we believe that community education and engagement will able to address the concerns and integrate genetic testing in a respectful, culturally sensitive manner so that it doesn't have to offend any cultural or religious belief. With the aforementioned reasons, we strongly affirm that genetic testing should be mandatory in premarital screening, and it is not just a scientific necessity, but a moral and social obligation. And African countries can actually prevent hereditary disease, alleviate healthcare burdens, and also empower couples with informed choices whenever they are trying to go into marriage. And for the aforementioned reasons, we strongly stand by this motion, and we are ready to support with any argument any day, anytime. Thank you. And these are our references.
Yeah, thank